Hello, how's it going? My name is Calvin Nava, and this is my presentation on phantom limb pain treatment for the course of Psych 129, Brain, Mind, and Memory, uh, taught by Dr. Oswald. So without further ado, let's continue. With our agenda today, we're going to have four phases. Phase 1, Introduction. 2, Causes. 3, Treatments. This is going to be listing our pharmacological treatments, non-pharmacological treatments, surgical treatments, and then we're going to end with our conclusion. So, with moving forth, our introduction. So the concept of phantom limb pain itself, right? So this is a pain that feels like it's coming from a body part that's no longer present. Um, Pretty straightforward, right? We have our image here depicting that. This person is getting a foot pain from a foot that's no longer there, unfortunately. Doctors once believed that this post-operational phenomenon was a psychological issue, but now, thankfully, it's recognized that these sensations originate in the spinal cord and the brain. So these are very real feelings. It's not something that's false thoughts, right? This is very real and occurs to people with these situations. So causes. It's not currently clearly defined, but there's a correlation to the brain and neurological connections to the neurons that are affected with these limbs. Imaging scans, such as MRIs or PET scans, have been neurologically or show that there's been a neurological connection to the neurons of amputated limbs showing activity when a person feels a phantom pain. Other factors are believed to contribute to this feeling, right? Damaged nerve endings, scar tissue at the end of an amputation, and even the physical memory pre-amputation of the affected area. Moving forth with our pharmacological treatments. So we have our two general realms here. So we're going to have our anaglesia. This is the absence of the ability to sense pain without loss of consciousness. And then we're going to have our anesthesia, the lack of feeling or sensation. These themselves come with their advantages and disadvantages. They fall under the same group. So advantage of this is stable intercorruptive conditions, right? They're effective. They have reduced nausea and vomiting. There's no effect on urinary function, so you will not relieve yourself. And then its disadvantages, it takes about 15 to 30 minutes to be effective, and even failure rate can occur within 5%, even with the best hands on deck. Moving forth, before we get to our opioids and other tablets, we have our acetaminophen, non-steroidal anti-inflammatory drugs. So these inhibit the enzymes needed for the synthesis of prostaglandin and decrease the nosipin, peripherally, and centrally. One major side effect of this is they decrease the effect of the normal blood clotting factored in blood. So moving forth with our first group opioids, specifically for this, we're going to look at morphine. So this provides anaglesia without the loss of touch or perception or consciousness. It's an effective treatment for neuropathic pain, though it's controversial in its use and is limited because of the side effects and potential for addiction. Moving forth with our tricyclic antidepressants, also known as TCAs. This is going to be that tablet right at the bottom. These are commonly used for neuropathic pain. It's another anaglycic inhibition of serotonin, norepinephrine uptake blockade. These do come with their own side effects too, such as cardiotoxicity, weight gain, dizziness, and insomnia. And then lastly, with our anticonvulsants, these prevent or reduce the severity and frequency of seizures in various types of epilepsy, but are also an effective way to take care of pain. They work in a number of different ways, which all have a relevance effective to their pain. And then with our non-pharmacological treatments, first we're going to start with our TENS. So this is going to be your transcutaneous electrical nerve stimulation. This generates the skin to activate affective nerves. So this is more or less simulating the nerves, right, to get the sensation needed. Moving along, that one is safe and easy to control. Moving along, we have our mirror therapy. This is first introduced by Ramachandran in 96. A person with an amputated limb uses the mirror or the mirror box to reflect the image of the intact limb, right? So it feels like it is there. Patients with this showed a decrease in pain at the end of 6 months post follow-up. And then we also have our prosthesis to help you fully regain the feeling with prosthetics moved by signals released from the brain. Then moving along, we have our surgical treatment, right? This is not recommended, very much avoided due to the side effects that end up becoming present in the individual. With this, this is more or less for infections, right? Or stump revision. Patients experience numbness, tingling, or impairment of the surrounding nerves because of these operations, so the affected area becomes even more affected. So in conclusion, right, treatment for each individual is a multidisciplinary approach that should be tailored to meet the needs of each individual patient, and which provides the best chances of improving the symptoms of phantom limb pain and the functional outcome. So with that, right, I have the circle here. We could use each domain to get the exact feeling that we want back, right? We don't want this person to be uncomfortable. We want them, for example, to use opioids to lessen their pain, right, as they're going through the process of being amputated. And then maybe they're going to go ahead and use mirror therapy to regain the sensation of having their hand back. And then finally, if things aren't feeling so well, we're going to go through surgical treatment in order to dampen the pain that is there. But yeah, thank you. That is my presentation.